Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together we have
therapist.
the most famous physical therapists on the internet.
In our opinion, of course,
Today,
Bob.
Brad, we're going to talk about 7 60-second stretches that you can do to stop your knee pain now.
Now, 60 seconds,
Yep.
one at a time.
And the reason we did this is because people are busy, Brad. They don't
Right.
have time for pain, right? They don't have time
Exactly.
for anything.
Yeah.
So they certainly don't want to have time for pain in their life as far as knee pain. So, give these a try. Some of these are going to help specific problems that you may have with your knee, and we'll try to mention those problems as we're going along.
Sure.
So, and if you are new to our channel, which I
If
see
you
some
are
of
new.
yeah. Please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to Facebook and like us, because Brad and I, as children, were not liked, and now as adults, we're hoping somebody will like us.
My mom liked me, though.
Did she?
Oh, yeah.
Oh, that's what we said one. Okay, so let's start with number 1, Brad. This is a good one, especially for people who have arthritis in their
Sure.
knee. And this is a Mackenzie technique, but what you're going to do is you're going to put your leg up on a stool, and what you're going to do is, this is especially if you are lacking full extension, if your knee isn't straightening out all the way. With arthritis, any little gain you can make is going to decrease the pain, they have found. Because what you're doing now is, if you can increase the motion in the joint, you're spreading the forces out more.
Right.
If you're just moving in a small range, it's wearing out the knee at that one spot.
Sure.
So what we're going to do, again, if you're lacking knee extension at all, I don't care, even if you don't have arthritis, this is a good one for you to do. So you can do pressure on, pressure off.
Yep.
And you actually say the words, because that tells you how long you're going to do it.
Right. It's kind of a built-in timer.
Right. Pressure on, pressure off.
Yeah, you could kind of sing it.
Pressure on, pressure off.
Yeah, we can
that
make
was
it
awful. And what's nice about this is it's very easy to do throughout the day.
Sure.
You can be at the office and you just put your foot up on, your neighbor's desk and or neighbor's chair, and just go ahead and do a few of these. In fact, that's how these work out better, is if you do them like every hour or every, throughout the day,
Right.
you're going to get better results. And you can do 10 of them.
Sure. Yep.
So-
Probably 10's enough.
Yep, 10 will be
At one
enough to
time,
start off. Now we're going to go into the opposite direction. The same is true is if your knee is not bending as far as, the non-painful
Right.
knee.
If it's stuck and you only go about this far and it should go up to here, if you can regain that range of motion.
It's going to decrease the pain. Also, if you are having trouble with meniscus, I have found with people, sometimes if they have trouble with their meniscus tear, or maybe a piece of the meniscus is floating around there, sometimes this kind of readjusts things. I've seen this happen more than once, Brad.
Okay.
So,
Show it.
so what you're going to do is you're going to get a chair, and you're going to work on, this is a Mulligan technique. We're going to give credit to Brian Mulligan. And what you're going to do is you're actually going to do a movement here. You're going to grab onto the lower leg, and you're going to turn it counterclockwise.
Sure.
Now, that's for the right leg. For the left leg, you'd be turning it clockwise. I'll show both.
Right. So he's going to actually
So I'm
rotate
grabbing
it
like this, and I'm turning the lower bone this way
towards the big toe.
towards the big toe. That's a good way to put it on, whatever leg you're on,
Right, 'cause
towards the big toe.
The big toe is usually on the inside.
And keeping pressure the whole time, I'm bending the knee. And I'm trying to bend as far as they'll go,
Right.
pain-free.
Do you always work out with those socks on, Bob? Those are
No,
pretty cool.
those are my those are my dress pants socks.
I just thought
So
I had to
I'm
bring
looking
that
like
one up.
I'm looking like the classic nerd, aren't I?
But we're talking about the knee.
Yep.
So this is a nice technique.
Same thing again, 10 times, pain-free. If you can only go this far, pain-free, just go that far.
Yep.
If you can go all the way down, go all the way down.
As long as it's pain-free.
So again, obviously on the other side, I'm going to go clockwise now. I'm going towards the big toe, and I'm bending the knee. All right, are we clear on that, Brad?
Yes, Bob. I'm
I
very
used to have
clear.
one instructor, are we clear as mud?
Yeah.
He had a little southern accent, he always say that, are we clear as mud? Okay, you can also just do regular stretches of the knee into flexion. You can, lay on your back,
Oh,
and you can go ahead and just pull the knee up into flexion like
sure.
this too.
Yep.
Just regular stretches, pressure on, pressure off, pressure on, pressure off. All right. Now, if you're having a patellofemoral problem, in other words, the pain is happening kind of around the kneecap, maybe it feels like it's underneath the kneecap,
Yeah.
generally it's going to be helpful to stretch that kneecap.
This is
So-
really common going up and downstairs, particularly downstairs is usually a little more painful than up, but it's
Yeah.
common.
So what you have to do is you have to make sure the leg is very relaxed. Are you able to see this, Lonnie? She's focusing as we speak.
Right,
And
right.
you're going to take your thumbs and you're going to push the top of the kneecap down. And I'm pushing on, pressure off. Pressure on, pressure off.
Yeah.
Pressure on, pressure off.
Because the kneecap is made, you know, it should float around. That's normal. It's actually part of the quadriceps tendon. So all the quadriceps connect to the top, and then there's a tendon at the bottom of the kneecap that connects to your tibia. And that needs to float free up and down as well as...
Yep, we're going to go side to side
Right.
too. Yep, I'm going to take my thumbs and now I'm pushing it out this way.
That was my segue into this, Bob.
Very good.
Yeah.
And then I'm going to push it the other way too, towards the other leg.
I just had a patient I was doing this with, and it just absolutely, she couldn't even watch it. She said, that just freaks me out when I see someone move my
A
kneecap.
lot of people get the heebie-jeebies doing
Yeah,
this. It just bugs them. And then I can go toward me too. Just taking my two fingers and moving it this way. Now, just by loosening this up, it's going to put less stress on the underside of the patella, or the kneecap when you're
Right.
working out, so or when you're doing things. So hopefully that'll relieve. Again, it should be pain-free. I don't want you to, ow, 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 it's hurting.
Right.
It should feel fine when you're stretching it.
Right. Maybe the
Otherwise,
first time a little pain, but as you do it more and more, it clearly gets feeling better and better to pain-free.
All right, if you are getting pain, like let's say on top of the knee, a quadricep tendonitis,
Right.
this is a good one to do. You want to show this one, Brad?
This is one people that ride bicyclers can get, particularly if their seat's too low.
Oh, sure. Yeah,
I just had someone that got this now and his seat's too low on his mountain bike. So we're
this
addressing that problem
This
too.
is one of the issues Brad and I brought up many times because I have a friendly guy in the neighborhood and he rides a bike and his knees are going way up high and I want to tell him, but I just don't feel like I can. I feel like he's going to be insulted.
Sure. Now with this, if you can lay on your stomach comfortably, it's a good way because it stretches out the rectus femoris, one of the quadricep muscles, and it keeps everything in that neutral position. Be careful about a hamstring cramp because
Yeah.
some people will cramp up here. And you pull like this, and that will stretch. You'll definitely feel it stretching the quadriceps. Even better if you do have a stretch out strap like this.
Or a yoga strap. We
Yeah.
got one listed below in our Amazon products that we love. So if you go down into our description, you can see this.
And you can see how this makes it a lot easier to do. You can go in it, and the nice thing about these are straps is they got loops, so you can put your hand in, which even makes an issue. Or if you're not, it's just easier one way or another. You can just see how easy. Right now, stretch on, stretch off, on, and if you want to hold it longer, you're welcome to do that. Oh, that does feel good. Okay.
Now you can do this sideways too, right, Brad?
Sure.
You can roll onto your side if you have a strap like
Yeah.
this.
You go like this, and you get these straps. Now I can do it here comfortably right around my shoulder, and that feels good, and it gives me, and then I can work it back there. I'm getting a good stretch. When the knee goes back is when you really get the stretch. If I'm stretching up here, not so good. Bring it back to here, and you can see with the strap, I'm really making life a lot easier.
Yeah, and
There
if you
we
have good
go.
balance, you can actually do it this way. I stretch it this way.
You bet, yep.
In the mornings and just pull back. Foam roller is another possibility, right, Brad?
Sure.
This is one of our favorite ones. It's a little less dense. It's softer. We have this listed down in our Amazon products too that we like.
All right, so I'm going to work here. Now, you're not going to roll over your kneecap. That's going to be uncomfortable and irritate things.
But by stretching out this muscle, again, you're taking some of the stress off the knee, and especially, again, like a quadriceps tendonitis, it's going to feel a lot better.
And then you're going to want to make sure that you roll. You can see I'm doing the inner part of the quadricep, and then over the middle part, and then over on the side as well. So you get all those fibers.
Do you want to maybe just go ahead and catch the next two right away, Brad,
Sure.
too, the IT band. This a lot of bikers get this,
Sure.
outside knee pain.
All right.
The IT band comes all the way down, attaches here, and there's some rubbing down here when it's tight. Some runners get this, so you definitely want to make sure, you want to stretch, especially up in the tensor fascia lata area, right, Brad?
Yep. So we're
which is-
talking way up into here.
Yeah, right in that muscle there. Yep.
Roll that all the way up down that IT band here. And this is where I need to unweight myself a little bit because it can be a little tender.
You really can't stretch the band, but the band, by stretching it, you're stretching the muscle.
Sure.
I don't know if that makes sense at all.
Just believe us.
Yeah, just believe us on that one.
We're not going to get into the mechanics of
And then
that.
finally, Brad, why don't you do the hamstring too?
Oh, yes.
We'll show some manual ways to, no, the hamstring with the ball. With the
Oh,
roller.
you mean the roll? I thought I
Yeah.
wanted to stretch it.
Yeah.
Oh,
We'll show some hamstring stretches
Little-
with the.
just a little minor miscommunication
Yeah.
between us. All right. So we're going to just roll this. And oftentimes, if you cross one on the other, you will get a more aggressive stretch or soft tissue work with that massage or with that roller. And I like to get right up to that, to the buttock area where that ischial tuberosity, where it connects that from the muscle to the bone.
So if you don't have a foam roller, you certainly can stretch these without it. We can do an IT band. You can actually hit this by even against a wall like this. You can stretch like this,
Yep.
and then you can cross over like this. I'm stretching this one, and you can look at how I can really put pressure on there.
Sure.
Really get a good stretch on it. Do you want to show the one laying on your back, Brad, for the IT band? You want to do that crossover one and pull it up?
Oh, the figure four?
Yeah, the figure
Oh,
four.
yeah. I was waiting to do the other one, but this is good. So I'm going to cross like this, ankle on top of the knee, and then you'll see I usually grab over here. You can grab here if you want, but here you can push here and here. I take my forearm right there, and I put my hand here, and I get a really nice leverage.
Again, though, if you're getting pain on the outside of the knee, you want to stretch that IT band out. It's going to pull on that area and put stress on it, so it may seem a little strange. You want to show the other one that your friend was telling you about, Brad?
I had a friend, when he was in his 50s, he was running a lot and having knee pain, and biking having knee pain, and he thought he was going to have to hang it up. And he thought, I'm not going to be able to do these activities. And he said this stretch right here, he would go like this and pull here and stretch that AT band. Pain in his knee went away. He said it just took care of it, changed his whole life.
Just shows you how stretches, can keep you going.
Yeah.
And here he would have stopped, but all
Right.
he did is one simple stretch.
Yeah,
And
he found that key spot.
And I have found that on people too, that to be true. Now a hamstring, the way I prefer to do hamstring is to lay down, and I put my foot up on a banister. But again, this is where the stretch out strap comes in real handy, or the yoga strap, whichever one you like. You put it around the foot like this, and you can go your hands into the loops, and up you go. This one just works out really good.
Yeah. This is nice because you can do it in a relaxed
Yeah.
fashion. You're laying down. If you're doing some other stretches already laying down, you can incorporate this in when you're watching TV or
You wanted to show your stretch of the hamstring, Brad?
yeah. Before I go running, this is what I'll do. I've got outside, I've got it's a stair that I just put my foot up. I keep my back straight, so I'm not stretching my back. I'm stretching what I want down here. And I breathe and relax and hold it for maybe 10 or 15 seconds. Did I tell you about the guy? He was a construction worker. He would do this stretch and he'd have a cup of coffee. And he said he would put his foot up at home until he got done with his cup of coffee. Then he would do his other one.
No kidding.
Yeah, he said it made a big difference on his back pain.
Right, it
You
does.
know?
Yeah, and we'll have to have a video on that too. The final one you're going to do is if you're getting some pain on the inside of the knee, especially what we call over the pes anserinus bursitis. That's a big word, but pes means anserinus means like goosefoot.
Ah.
But anyway, a stretch for that. There's a lot of different ways you can do it. You can go ahead and put your foot up like this and stretch.
The idea is to stretch
yeah.
the adductor muscles.
You can
in
bend
here.
your knee like this, right, Brad?
Sure.
And stretch down like this.
Yep.
Again, I'm stretching the inside. You can just lay down and do it. Yeah.
Or you can
Yep.
do this one to get those muscles if you're able to get in that position.
This is the way I do it in the morning. I just wake. I'm laying down on my back. I'm just letting it stretch out that way. So give these a try. Again, these aren't ones that you have to do every one of these. you want to pick the ones that seem to help,
Right.
and those are the ones you're going to want to repeat day after day.
Sure.
So
All right.
we're running along, Brad. So thanks for watching.
How did that time get away from us?
I don't know.